Hey, it's Jessica DaMassa with WTF Health. Joining me right now, I have Sam Brasch. He is the Senior Managing Director of Kaiser Permanente Ventures, right?
Yes.
All right.
Very good. Thank you.
All right. So tell me a little bit about KP Ventures. What do you guys invest in? Are you guys are a strategic, so you're investing off the balance sheet.
Yep.
So tell me a little bit about that.
Yeah. Actually, we're not investing on the balance sheet.
Oh, you're not? Okay.
We are a dedicated venture fund. So
Okay.
KP's had this program for about 20 years. So long-standing strategic fund, probably one of the oldest ones. I think Ascension is similarly kind of 20 years old. We have dedicated pools of capital, so we just raised our fifth fund. Each one's about $150 million. It's mostly Kaiser Permanente money, but we actually have some outside partners. This fund, it's Henry Ford Health System, Highmark, Tufts, so great strategic partners.
Awesome.
But the team and I sit inside KP. We're sitting there trying to represent an understanding of KP's view of like where innovation's needed, what solutions are best suited to the marketplace and KP's needs. And then we invest in these businesses and try to help them grow and be successful companies. So,
All right, give us a list of some of the notable startups that you've invested in.
glad you asked.
Yes.
I'm going to go through all 70.
Okay,
No.
please. Everyone sit down. No.
So, big portfolio because 20 years.
Yeah,
We got about
absolutely.
30 active companies right now, but there's a bunch of people know about. Ginger, the offices we're standing in right now. Health Catalyst, the recent IPO, a lot of people are familiar with. Omada Health. We're doing some things. KitCheck for tennis. I'm trying to think if I start skipping names, everyone's going to get mad at me. But there's a very long list. It's a combination of health IT, so everything from kind of digital, consumer-oriented stuff to really health enterprise, IT solutions, healthcare services. And then we do, and it's a smaller part of what we do, invest in medical devices and diagnostics as well. So, iRhythm was a neat company that blends in all those spaces that we had a nice investment in and exited as well a couple years ago.
All right. Well, I wanted to pick your brain about what's going to happen here in the near-term future. Well, maybe not the near term exactly, but over the next year or so in digital health in this space. I mean, you've been watching this space for a long time. And actually, you said that you have a background that's both as a VC and as a strategic, right?
Yeah, I've done both parts.
Both parts.
So I started my career about 15 years ago in venture with a more traditional venture fund, all healthcare focused, and then about 7 years ago joined KP's fund. And I came to KP right when digital health was starting to become a thing. So I've been able to watch both from afar and companies I've been involved with, seeing how we're maturing in a space. And,
what do you think?
It's taken us a long time, but it's exciting. I mean, we are now getting to the point where not only are we starting to see exits, which is great. I mean, Health Catalyst, which is not a digital health company, it's truly an IT company, but great validation that they've built a real business. Livongo, another really good business. And we're starting to see other companies, even on ones in our portfolio, like Omada, maturing. And what it's telling to me is like they have figured out what the business models are, and it's been tough. We all are learning together, whether, is there a DTC opportunity? We're learning no. How far can you get with employers? Pretty far. How do you penetrate the payers?
Yeah, usually it's the payers providers, not going to point any fingers here. They're the holdup, but so
we are the holdup. Yeah. No, let me confirm. We are slow moving. We're not quick to adopt new things. But what we're starting to see is that companies. So not only do we have trouble just making decisions, and we're a pain in the butt in many ways. Not KP, all of us. But we're also starting to see companies generating the data and the evidence that actually is compelling and validating that their solutions make sense. And so, while it took longer than everyone would have hoped, the companies, and again, like Omada and Sean Duffy, it's amazing what they've done, but their commitment to generating data and proving out that they actually are not just having a nice app and not just a solution that makes sense on paper, but truly, driving outcomes, that's starting to show up in the way that customers are signing up and revenue's growing and valuations are going up for these companies as well.
Do you think it's really, has the wait, all of this time that it has taken, has it really been for the outcomes data, or has it also been because of the fact that it's like, how do you reimburse this stuff? How do you build a payment model around this? What kinds of workful processes have to, there's so much more than that.
It is all the stuff.
I mean, and you have, from your vantage point, somebody might look at you and say, well, you're in an interesting spot because you have a payer and a provider in your organization, right? So, why can't you just nudge these people along?
Our job is not to convince them to use things, but our job is to help them introduce and understand what's out there, but also to share back with the companies and come back to them and say, hey, you know what? People thought this was really cool, but until you've got 2-year longitudinal data, or until you've figured out how a doctor can actually prescribe this and not just understand that it's available, it's not going to happen. And so it has been interesting for us in the perch we have at KP to kind of understand, why aren't they adopting it? Why do we go from, when we do the diligence, we get great signals and feedback that, oh, wait, we think this is really good. big unmet need and a solution that makes sense. Why doesn't the adoption happen right away? It's because there's a lot of hard work that needs to happen. And then to answer the question a few moments ago, it's taken a long time, yes, to generate data, but two, just to figure out how to run these businesses. So how do you get paid for them? How do you prescribe them? Who do you need to educate and help inform along the way? What's the right channel? All those things were hard to figure out, and so we're getting there.
Do you think we've hit an inflection point with that? I mean, I feel like there have been a couple big things that have happened last year. So you had a couple PBMs create like digital health formularies, which kind of then makes this digital health stuff function the same way a traditional pharma product would function, both in terms of the way that they structure agreements and also the way that people can access it. But we've had things like that happen. We've had some acquisitions happen. We've had some partnerships. So I mean, what are your thoughts on that? Do you think we've hit an inflection point?
I don't know if it's a singular inflection point, but I think we are making we're making really nice progress. I think the formulary part is still the last hardest part that we haven't solved for. So it's great to see the PBMs doing it. It's great to see we have a company in our portfolio, Big Health, that got on formulary with a large PBM. Like those are good early proof points. But I think that last mile of how we're going to make sure that these tools get into the hands of a patient and doctors prescribe them and otherwise is still a work in progress. That said, I think there's enough progress that's been made by enough companies that everyone is over the concern that this is just none of this is real and none of this is going to be valuable and we can ignore this stuff. And so I think the great part is we are past that point in time, and the good companies with the valuable solutions, with the outcomes that really pan out, are going to succeed.
Do you think the tech companies coming into this space are going to only add to that credibility, or does it take it in a different direction completely? Where again, now we're going to be like, wait a minute, do I want Google looking at this, Amazon, and with all of the reach and all of the data they have access to and all that stuff? Do you think that there might be a swing back?
I think I'm mostly optimistic about the role that technology companies are going to play. I think it's good for us. I mean, they understand how to build big, scalable, impressive businesses, and we don't have a lot of experience doing that from the pure healthcare side. And so their perspectives will be great. Their role will be valuable. There's going to be some messiness along the way when people understand, like, what is the right way to engage with data and health systems and technology companies. And we saw that already with the recent kind of concern around some of the agreements that big tech had put together. And again, some of us from within healthcare said, but that's what we do all the time. But it was a great reflection back to us of like, oh, but that is concerning, and we all just need to be really thoughtful about this. So
I feel like my own prediction is kind of this is going to be a big year of talking about more of those ethical and policy kind of issues. I think that we're going to hit that point at this point right now.
Yeah, and the one thing I don't get too concerned about is a lot of the efforts that our startup companies are pursuing, that all of a sudden Amazon, Google, or Apple is going to come in
and take it away.
And take it away or make them irrelevant. Like I think they're playing in different ways, and they're going to be important channel partners, and they're going to be important conduits, and they can own a lot of important things, but they're not going to make the digital health efforts irrelevant.
Talk to me about the community of investors. So another thing that we've seen, and we were talking a little bit about this, was a great tweet stream out there about some of the hospitals that are closing their venture funds. So I mean, weigh in on that for me. I mean, do you think that it's one of those things like where they're out of their element, or is it just because of the way that they're structured as strategics, where maybe they are going off the balance sheet and they're not having the best year anymore, and they're like nervous about making risks? I mean, what do you think that's all about?
This will be a horribly self-serving take. That's why I'm here.
We love those.
Exactly. Let me tell you about why we're doing it right now. One, I think the proliferation of strategic funds has been great. Like, I mean, we love partnering. We think what we're doing is valuable for the ecosystem. We think other strategic funds are good. I do think it's hard. And I benefited, my team, we all benefited that, KP's been doing this for 20 years. Like, we figured out the hard parts that were, some of which was articulated in that tweet thread, which is, a dedicated pool of capital is important. You can't be coming in and out. Understanding your decision-making processes, making sure you know why you're doing this. Is it strategic, financial, or what in between? So I think it's not surprising that groups have come into it because they've all looked at it and said, well, why wouldn't we do this? We can make money. We're smart. We understand healthcare better than these other people, and let's do it. But then all the actual nuances of how do you run an effective investing program are really challenging. And so, my take is there's a bunch of really good strategic funds. There's a bunch of funds out there that have strategic LPs, but they're not pure strategic. It's all good. Some of these one-offs, and I think Bijan mentioned 4 of them that went out of business. There's still about 130 left. So I'm not worried that strategic funds are going away. I know our program's around for the long haul, and I think it's mostly good, but it's not easy.
Yeah. What do you got your eye on? Is there anything that you're not looking for anymore, or anything that you're looking for more of?
The things, I think we've all learned a few things over the years.
Tell us, Sam, what have we learned?
Let me tell you what we've learned. We've learned that point solutions are really hard to execute on. We've learned that is not easy. We've learned that anything that goes up against some of the big EMR companies, including one that won't be named, it's really hard to sell against them within hospital systems. We've learned that hospital systems in general look at new technologies and say, is this really worth implementing? All the work that's going to go into us making this successful is going to be a pain in the ass, even if it solves for something I need. And so you have to have a really strong value proposition to get the time and support of a large hospital system. But we've also learned that if you generate the evidence, some of these digitally oriented engagement solutions are driving really impressive outcomes in healthcare that are going to be a key to how we actually make this whole thing work better.
Right. And you're looking for what? You said anything?
What are we looking?
Yeah, don't think you're getting off of that. Anything in particular? Like one big thing that you're excited about?
One of the areas we're starting to spend some time on is just the elderly and the needs of that elderly population. And again, I wish we were unique in this, but we're not. But I think a lot of us are looking at this and saying, we have an increasingly aging population. They're dealing with diseases, whether it's Alzheimer's, dementia, or other healthcare needs that we as a healthcare system are not well set up with in terms of helping them and helping them solve for those things outside of the care delivery system in the hospitals or at the doctor's offices. So there's a lot of things around either the medical home or supporting that aging population that has me really excited, maybe because I'm feeling old. So
Come on now. Well, you have been in this for how many years now? I don't know. And you're a wise old man telling us what we learned.
I tried that one. No one
Wait,
believes
should
me.
I hashtag okay boomer you right now? Because I kind of feel like I should. Oh no, that's terrible.
There's a lot of stuff we're looking at that I think there's no lack of interesting problems to be solved. So it's finding the right businesses and finding the right people to work on them.
Awesome.
So.
Well, Sam, thank you so much for stopping by. It's such a pleasure to pick your brain. So it's been really fun to talk to you.
Cool.
Thank you. I'm Jessica DaMassa with WTF Health. Thanks for joining us.